Welcome back to our mini-series on Ayurveda. In this video, I would like to discuss with Dr. Kesarkar the concept and the understanding of randomized control trials. The reason for this is I'm trained in modern medicine, and what is ingrained in me is the concept of evidence-based medicine, as in we take data from trials and from clinical studies, and we come to the conclusion that such and such treatment or such and such pathology works in particular ways because this and this and this trial says it does. So what is a randomized controlled trial? In a randomized controlled trial, we take a group of people based on statistical calculations of what it is that we want to prove, and we divide them into two groups where people are randomly assigned to, say, a particular medicine that we are testing versus either another medication that we want to compare the first one with, or with a placebo, where we say we want to see the efficacy of this drug A compared to either drug B or a placebo. And so we randomize these two groups, as in these groups are assigned randomly. So there is no bias in who we are selecting for a particular treatment. And then we follow them over a period of time that is also derived through statistical calculations and what we know about that drug from previous trials and from experiments. And then we come to the conclusion whether this drug works or not. And the highest level of evidence that we accept in clinical guidelines is through randomized controlled trials. Because there are other types of trials where we observe, they're called observational trials, where we observe the effect of a particular drug or a particular procedure or whatever it may be in a group of non-randomized study subjects. And this could be done prospectively, where we just enroll patients or study subjects in an ongoing basis, or we take a collection of people who have already had that particular intervention, and then we see whether it worked or not. So that's an observational trial. So there are many different ways of doing these kinds of clinical studies, but the highest level of evidence comes from randomized controlled trials, and it makes sense logically, because we know that in a randomized controlled trial, we are avoiding bias. And without going too much into it, what I have found in my own experience as both a clinician and a scientist is that randomized controlled trials are not the full story, because we learn a lot also from observational trials as well as from registry data and so on. So the question here for you is to elaborate on the concept of evidence-based medicine, particularly as it relates to Ayurveda. Because what I'm seeing now more and more, what we are seeing more and more on PubMed and other places, is that Ayurvedic practitioners are being compelled to prove this science through randomized controlled trials and through publications in order to be validated by the modern scientific community. How do you feel about that? Is this what Ayurveda needs? Is this the kind of evidence that the world needs with regard to Ayurveda? What do you think about all this?
Thank you, Kavita ji, for having me on your forum. This is a bit of a tricky question, and before beginning my answer, I say I'm not here to offend anyone. I'm just putting my views of my observance in my own research of 20 years, clinically doing on single herbs, and how exactly I share these concepts with people. So the first question occurs is, when we do a kind of a randomized trial, we are already taking a particular set of symptoms and we are evaluating what drug is going to be beneficial for it. Now, let me cut through and let us say that, okay, you are using a chemical, let us say metformin, for example, for diabetes. And let us say I want to try a herb called guduchi, Tinospora glabra, for the same purpose. What I'm going to do, maybe I'm going to, as you said, one batch random with metformin, one with Tinospora, one combination, one placebo, who might feel that they are getting metformin or they are getting whatever it is. And we will compare and we will see on blood parameters, which is more efficacious. Now, in the previous video, I said that Ayurveda is a conceptual, cosmic conceptual building blocks, which we understand from a human point of view. So, if we say, for example, in Ayurveda says that all medications alter the doshas. If they are dosha combination is just for for this video, I'm taking this example. Then does not metformin does the same? Because even it is altering the doshas. So how can metformin be chemical and this Tinospora be Ayurvedic? So we have to first understand that any medicine which is happening throughout the world, it has to come under the concepts of Vedic, because we are talking about building blocks. We are talking about understanding something from a futuristic point of view. Like for example, now in modern medicine, we see that a group of people are developing hypertension as prime symptom. Earlier, as you are a doctor, a cardiologist, hypertension was an accompanying symptom in heart disease. Now we treat hypertension as a solitary disease. Now why it has come? Because modern doctors felt that because this symptom is seeing so high, we have to treat it as a disease and then look for the causes. We cannot just say it is an accompanying cause in kidney and heart disease. And then maybe you can try to find certain medication to lower it because you have a prognosis, a graph of what exactly damage it is going to do your system. Now, with respect to your system, it is an absolutely fantastic thing to do because you know what you're trying to achieve, what you're trying to gain. You're going to stabilize it. Again, as I say, stability, movement, transformation. Now, what is happening is that with modern medicine or with Ayurveda medicine, a lot of people are saying, okay, I took this medicine and my 20 medicines got all right. You're a cardiologist, people might come to you for heart problem. In that, they might have an underlying diabetes issue. Then you will say that, okay, no, I have to refer you to a infectious medicine doctor, something like that, whatever the specialty is. But when a person comes to an Ayurveda doctor, for example, I practice in India and they have got a lot of medication and nothing to do. When we instill these concepts of diet, we instill these concepts of medication, everything changes and maybe they are reduced to no dosages. Now, how do they know they are dosage free? Because we check the blood and we see, okay, everything is stabilized. But for us, the disease doesn't end there. That is just a pathological stability to get off certain drugs which they were already on before they visited me. Why I'm making this concept, this tangent here, that in modern medicine, in modern world, Ayurveda doctors and us, we have to understand that we cannot do something which is limited, randomized trial, by substituting chemical for herbal. The entire concept of how exactly this diet, from getting up, being aligned with the forces. And I know when we talk of like being aligned with the forces, being aligned with the nature, it sounds too unscientific. It sounds too, like spiritual. So we have to get out of these concepts and we have to understand how can we apply these concepts in future for diseases which are going to come and create a base model depending upon finding this diversity and unity within our own concepts. Just by doing a randomized trial and introducing a herbal drug as an adjuvant for chemical is not going to help. It is still going to be a chemical. You know what is going to happen tomorrow? You are a allopathic doctor. So tomorrow I say, okay, for your heart, don't use this beta blocker, use this medicine. The dosage is two tablets 3 times a day. How exactly am I serving my purpose? You're going to say, no, I'm using an Ayurveda medicine 2 tablets 3 times a day. How exactly it is promoting Ayurveda concepts? It is not. You're just substituting something with something. And we are saying, okay, now Ayurveda drug has been. There is nothing called as Ayurveda drug. Because Ayurveda has used animal products, plant products, metals, nanomedicines, anywhere you go. Today also for rheumatoid arthritis, we are using gold injections in nano form. People are working on in certain Alzheimer's and certain diseases, small amounts of arsenic is used. But Ayurveda already perfected this long back before in metallurgy, in different kind of medicines of how exactly any chemical natural form can be used to treat the body. And these concepts which I talked about, Vayu, Pitta, Kapha, which I told you how foundational they are. If we understand them, if we create a kind of a technology, a kind of uh, model where every person who comes for a trial in Ayurveda is understood on this, and we try to collate these so many streams into a singular form, which Ayurveda is very pretty able to do. This will help push Ayurveda and Ayurveda doctors much in front of modern medicine, or maybe in parallel to their own stream. Because tomorrow, when we are talking about artificial intelligence, we are talking about diagnostic methods which will be more computer based, which will be more robotic based. How genetic is going to come up? How exactly we are going to go to Mars? How exactly are we going to use these concepts if you are going to think that no, herbal versus chemical? So I personally feel the idea of randomized trial is not bad. You can do a randomized trial, but those randomized trial must come on the concepts, foundational concepts of Ayurveda. They cannot come that you pick up a disease and you do. You have to pick up let us say a person comes who has heart disease, diabetes. As you're a doctor, you know that when a person visits you, doesn't only have heart disease. He'll have lots of diseases. Right time the heart is giving a problem, so he's been visiting you. So when we take this group of clusters in Ayurveda, the diseases are understood as syndromes. There are very few diseases mentioned in Ayurveda. Not because we knew less, because we understood that one disease encompasses everything. Like I told you, the doshic concepts encompasses everything. So when we say Jwar, which is the biggest disease, fever, it encompasses all the kind of fevers which are going to come as a symptom, as a primary disease in the future, now or in the past. So when we keep these concepts, when we take a group of people on those diagnostic parameters, those diagnostic parameters could be anything, because we know they are again going to come under these three concepts. We start using medications on Ayurveda principles. It doesn't matter that you're using some allopathic drugs to stabilize the system. Because you're not doing it to stabilize the system, you're understanding the dosha constant of it. Like if a person right now requires to stabilize his heart, so we know that Vayu is not overall in the body. You use a beta blocker or you use any other herb, it doesn't make a difference. Why? Because you're working on those concepts. And eventually in the end, when you stabilize a person and you give an abstract or a discussion that how exactly it progresses on pathophysiology, on immunological parameter, metabolic parameters, whatever the parameters, I think this concept collectively will help a lot of Ayurveda practitioners to usher ahead, and it will also promote the right kind of education. If we just be hell-bent on randomized clinical trial, it could be a procedure like enema, virechan. They will always be an adjuvant to modern science. It will never flourish as an individual science. And I think somewhere we have to now think, in the era we are staying, understand what is going around us, how exactly the concepts of people are changing, medicine are changing, and we have to come up with the strategies if we have to integrate this great science, this futuristic science and its fundamentals in not only medicine but anything, any kind of thing which are the challenges of the future.
Thank you for that explanation. That makes so much more sense actually with regard to trials and their use and their benefits in modern medicine. What I take away from what you said is that the primary difference between modern medicine and Ayurveda is that in modern medicine, we look at diseases. So our way of diagnosis and treatment and prevention is based on a disease rather than or it's based on organ systems rather than a more all-encompassing approach that is the hallmark of Ayurveda. And I like that you said that there are very few diseases in Ayurveda, or rather there is a description of few diseases because of this understanding that there there tend to be more of what we call syndromes, that one pathology can be found to be the underlying thing of various other manifestations in the body. And often when I'm talking to patients, I give them the analogy of a tree, that, you know, a patient may have high blood pressure and diabetes and kidney disease and heart disease, and all of these are like, you know, leaves of a tree. And they go to a nephrologist, they come to me as a cardiologist, they go to an endocrinologist for the diabetes, and so on. And each of us is trying to look, and we almost become very myopic in our understanding of this disease by, you know, we are just looking through this lens of heart disease, coronary artery disease, or diabetes, and let's just treat that. Instead, what Ayurveda is saying is look at the roots. So why don't you address the roots so that all of these problems can be addressed at the same time? And randomized control trials are really, you know, about the leaves. So we take a drug or a procedure or, you know, any kind of preventive measure in order to treat, diagnose, or prevent one particular leaf of the tree. And if we try to use Ayurveda in the same way, where we take the same, you know, take a herb or an intervention for that leaf, then we're not doing justice to the science, because the two sciences are so different. So when we try to reduce Ayurveda to that of being restrictive, or if we try to bring Ayurveda to compete with modern science, then we're not doing it justice, because they're two different things. And this is actually very important, I think, for us as not just practitioners and enthusiasts of Ayurveda to know, but also for the general scientific community, that randomized control trials are wonderful, but they are not the only way to understand whether something works or not. And there have to be other ways of validation and other ways to honor and to understand, because, and that requires an expansion of our own understanding of the natural world and of ourselves. I hope you found this video helpful, and we will continue the conversation.